first of all, is a woman, I know that some women can sense that they're ovulating, but what is a woman feeling on average during this period?
I always say this is the most important time because it's when a woman feels their best, they're also the most fertile. And so often this is when we see, like if we were to measure peak performance, maybe it feels a little bit easier. Women feel their best, which I think, although it may not change outcomes of performance, they might feel it has a direct translation to volume, quality of exercise, potentially sleep, kind of optimizing recovery.
Okay. Anything beyond that in terms of behaviors or changes you would make in training if you were coaching someone during that period of time?
I mean, in coaching, you often can't say, oh, it's ovulation, we're going to do things differently, especially if you have a whole team or an individual. But I would say that is a really good spot to understand peak performance. And so what we've done, and part of my interest in this field is understanding how certain aspects change so that we can do more research in females. So for instance, I often wouldn't test in ovulation if I am trying to understand how a female's body changes, or if I'm tracking changes. I would capture them in the follicular phase, or I would capture them in the luteal phase. Part of it is ovulation sometimes lasts a couple days, or a woman might have menses and bleed but not actually ovulate. And so there's a lot more variability, but that's where that technology comes in, where we can begin to narrow it down.